precious little baby. I can't wait to meet you.
I want to count your fingers and kiss your toes and sing you a lullaby.
I know that feeling. I couldn't wait for my baby to be born. But I'm so grateful that she went to full term, because a baby born earlier than 37 weeks is born too soon. Babies born too early are called preterm, and they often face serious medical challenges. They're small and often need help breathing and keeping themselves warm. And sadly, many die or have lifelong disabilities and learning problems. The best place for your baby to develop is inside your body, and it's important for you to do everything you can to keep it there.
I started feeling these weird pains, but I didn't want to think about it. Wrong move.
Believe it or not, 11% of babies in the U.S. are born preterm. You may have heard about these tiny babies who survive and do just fine. Well, they're the lucky exceptions.
My friend, she had her baby early, and she said it was great. The hospital keeps your baby for a few days, and she got a chance to get some rest. My baby comes early and almost died. We're just hoping she's not retarded.
It's really never a good idea to have your baby too early, because babies who come too early more than likely are going to be sick, and may be sick for their whole lives. So the important thing for pregnant women to think is that they should stay pregnant for 9 months, no matter what anybody says.
Fortunately, there are steps you can take if your baby starts to come too soon. If you go into labor before your 37th week of pregnancy is over, it's called preterm labor. The key is recognizing the signs and symptoms of preterm labor and taking action. Sometimes the symptoms go away. If they don't, your healthcare provider can give you medications that may help delay delivery and help your baby grow. In this video, we will identify women at risk for preterm labor, describe the signs and symptoms of preterm labor, show you what you can do if you think you're having it, and tell you when you should call your healthcare provider or go to the hospital, and why it's so very important that you do so. Preterm labor can happen to any pregnant woman. Many of them have otherwise uneventful pregnancies. There's no way to predict who will have preterm labor, so all pregnant women need to know the symptoms and what to do if they have them. But there are some women who are at the highest risk of preterm labor and birth. Women with a previous preterm birth, women carrying more than one baby, women who have a lot of stress in their lives, including being abused either physically, sexually, or emotionally, women who smoke cigarettes, women who use illegal drugs, who are younger than 17 or older than 35, women who have untreated vaginal or urinary tract infections during their pregnancy. If you fall into one of these categories, talk to your healthcare provider about your risk and make sure you know the signs and symptoms of preterm labor and exactly what you should do if you experience any of them. If you don't have any of these risk factors, don't turn off this tape. Remember, many women who have none of them give birth too early.
Patients need to realize that they have to be attuned to their own symptoms, to their own body, and they have to realize when it's time to go to the hospital, when it's time to call their provider.
What are the signs of preterm labor?
It's very important that women understand the symptoms of preterm labor so that they can get care quickly if they think they're going into premature labor.
What follows is an important list. If you experience any of these signs before your 37th week of pregnancy, you should take action. Menstrual-like cramps which may come and go. Contractions, a hardening of your uterus coming every 10 minutes or more often. Sometimes these contractions are painless, but if you feel them before 37 weeks of pregnancy, it is not normal and you need to do something about it. Low, dull backache. Pelvic pressure. It may feel like the baby is pushing down. Change in vaginal discharge or bleeding from the vagina. Abdominal cramps, maybe with diarrhea. Even if you experience just one symptom, you should do something about it.
I knew those cramps felt different. I'm so glad I went to the doctors.
What should you do if you think you're having preterm labor? Lie down on your left side for about an hour. Drink 2 to 3 glasses of water or juice. Don't drink coffee or soda. Feel your abdomen for contractions. If these symptoms get worse or don't go away after an hour, call your healthcare provider or go to the hospital. If the symptoms go away, you can get up and move around, but don't do what you were doing before the symptoms started. If the symptoms go away but then come back soon, call your healthcare provider or go to the hospital. What will your healthcare provider do? He or she will check your cervix to see if it's beginning to open. This is called dilating. If it's beginning to open, you may be having preterm labor. If you're having preterm labor, your healthcare provider may give you medications through injections or intravenously to stop the contractions. Depending on how far along you are in your pregnancy, your healthcare provider may also give you special medicines that will help your baby's lungs and brain mature faster. These medications can help prevent or lessen the severity of some of the worst health problems that premature babies face. They're critically important and could take up to 24 hours to become effective, so it's essential that you get help as soon as possible. If you wait, it may be too late to help your baby.
The midwife got the contractions to stop. Now I have the most beautiful and healthy baby. I'm so happy.
So when I feel cramps or when I feel my belly getting tight or pressure like the baby's pushing down, or I get a backache, or if there's any blood or water coming out of my vagina, then I should pay attention, right?
It doesn't have to be all the symptoms. Even if I only have 1 or 2, I should get in touch with my doctor.
And I should do it right away because the medicines take 24 hours to work. If I wait, it may be too late to help my baby.
A beautiful, healthy baby is every pregnant woman's dream. By learning the signs and symptoms of preterm labor and what you can do if you experience them, you're a step closer to making your dream come true. Thanks, sweetie.
For more information on pregnancy and the signs of preterm labor, contact the March of Dimes at askus@marchofdimes.com.